Hey there, it's Dr. Jim. Thank you for stopping by. This episode is a good one because I'm focusing on something new that I've not focused on for quite a while, and I don't think I've ever made a video or anything else like that pertaining to this very important topic. It's on providing bariatric care. And I've got experience doing this many years ago. I met with a bariatrician or a physician who specializes in bariatric care. And I asked this individual to train me as much as possible to help set up a bariatric care unit in a skilled nursing facility. And man, did I get a great education. So I have recently been inspired by our team to talk about this a little bit more. So I'm going to be getting into this topic quite a bit. But older adults with obesity, we usually think of the general American population as becoming obese. But did you know that elderly people now in the United States are a fast growing segment of our population, and there's a lot of obese seniors and elderly people that are becoming a big part of this population. And why is that a big deal? They're going to require very specialized care, particularly in their activities of daily living, the things that you and I do absolutely every single day. And quite frankly, we don't even think about doing these things. Washing up, showering, bathing, dressing, undressing, grooming, toileting, all of these things you and I don't really think about, we just do. So to determine if a person is obese means that we take their weight and their height measurements and we calculate them into what is known as a body mass index or BMI. A BMI of 25 or lower is generally is considered healthy. It's viewed as healthy, but a BMI of 30 or higher is classified as obese and sometimes clinically obese. And it does meet the requirement for bariatric care. So the BMI is far from perfect. Even, I've argued that many times throughout my career as well. But it is a generally good predictor of some health outcomes. So a BMI of 30 or greater is a pretty decent predictor of type 2 diabetes, of stroke, and of heart disease. So this is a very serious thing. So just a quick intro on bariatric care if you don't know much about it. It is a branch of medicine. It's a very specialized branch of medicine. And it's a specialty area that researches the causes of obesity, prevention of obesity, and then treatment of clinical obesity in the United States. Individuals with a BMI of 30 or higher will have numerous special care needs. So a BMI of 30 or more means that the individual is going to be 350 pounds, 400 pounds minimum. And I have met and I have worked with individuals who were 6, 7, and even 800 pounds. And those were those were life-changing events for me in a lot of different ways. Maybe I'll do a video just talking about those experiences and how they left these permanent thoughts and feelings within myself. I'd like to share that one day. So there's going to be issues providing care to a human being that weighs 4, 5, 6, 700 pounds or more. And, even things like personal hygiene become a major issue. The skin, for instance, is the largest organ we have. And with that amount of skin, we have to worry about things like skin breakdown, infections, sores, irritation, on and on and on. Other areas that will need attention are and are very important: diet, nutrition, and exercise. And just based on my own experience and, of course, all the research I've done on this topic, if an individual is 500 pounds, you might imagine how many calories they're consuming a day. It's in the thousands. It could be 4, 5,000, 6,000 or more calories a day. When they go into a rehab situation, sometimes the goal is to get them under 2,000, under 1,800, 1,600, 1,200 calories a day. Can you imagine what kind of adjustment that is? It is huge. In terms of exercise, this can be a challenge, a major challenge, but encouraging movement of any kind whatsoever is important, not only to lose weight, but for cardiac health and for improving self-esteem and self-image. And I see a lot of pride in individuals too, who get out of that wheelchair, get out of bed, and they start moving again in significant ways, maybe for the first time in a long time. So there's a lot to cover on bariatric care. Of course, I don't have time during this short video to do it, so stay tuned for more. My name is Dr. Jim Collins. Thank you for spending time with me now. I'll see you soon.